Welcome to Loma Linda University Health. I'm Dr. Richard Hart, president here at Loma Linda, and I'm delighted today to host a seminar for you on good health, ways we can retain and develop the good health that God has given each of us. I've got a group of experts from here at Loma Linda I want to introduce to you, and you can see in the background our campus and the new hospital and the campus sitting out here. That's part of the legacy that Loma Linda provides to the Adventist Church. So let me introduce those who are with me. Dr. Scott Lee, director of our Diabetes Treatment Center and an expert endocrinologist, diabetologist. Dr. Edward Bitok, with roots from Kenya, who's chair of our Department of Nutrition and Dietetics in the School of Allied Health Professions. Corey Geen, our executive chef here at Loma Linda, and we appreciate his good food periodically. Dr. April Wilson, chair of our Department of Preventive Medicine in the School of Medicine, and Olivia Moses, director of the Wholeness Institute. This group comes with an incredibly diverse background and expertise that we're glad to share with you today as we talk about the topic of good health. But first I want to start with COVID. It's racking our world. It looks like our rates are going down in the U.S. now, but even as I speak, it's devastating India. It's still devastating many other countries of the world. So I want to first turn to Scott. And Scott, you are a diabetes expert. There seems to be a significant link between diabetes and COVID. Talk to us why that is.
Yeah, you know, it's interesting because initially we thought that the link between diabetes and COVID had to do with blood sugars. So the elevation of blood sugars and some immunocompromise related to the diabetes. But what we've learned is that the real link has to do with metabolic syndrome. So when you think about diabetes, metabolic syndrome is really the foundation, and hyperglycemia is just the tip of the iceberg. And so it's really the risk factors of hypertension, obesity, cardiovascular risk that predispose patients to COVID. And we see that in patients with type 2 diabetes who have those risk factors are at very high risk, actually similar to someone who's immunocompromised for going on to getting COVID.
Thank you. And Edward, you and I share a love for Africa. And as I look at that continent and travel out there, clearly the old problems that I faced years ago, immunizations in the villages and malnutrition, now we have obesity and hypertension and diabetes in the cities. And how do we tackle that in a broad sense?
Yeah, and sadly that's still the case, Dr. Hart. I mean, it's been decades since you were in Africa, and we still see the same struggles. But now the problem has been compounded, as you mentioned, with the chronic diseases. And so we have a situation where most African countries south of the Sahara are having what we call the double-edged sword. They're having to deal with malnutrition and non-communicable diseases. At the same time, we are seeing those living in urban areas and in cities actually suffering from a lot of the chronic diseases. And so when you look at this whole problem, you try to see, where did it all go wrong? And so we see that a lot of the Africans have actually changed their lifestyles and mostly, want to mimic the Western lifestyle. When you look at a city like Nairobi, for example, we see that there's a lot of restaurants from America and other European countries that have actually set shop there. I don't want to list names, but there are many. And so we are seeing a lot of our indigenous African populations moving into the cities and actually embracing a Western lifestyle. And so really in dealing with the issue of chronic diseases, I think lifestyle is a huge component. And by lifestyle, there are two components to it. That is, being active, and of course the area in which I specialize in, which is nutrition. And so one thing that I really like to advise my people and the people in Africa in general is that some of the indigenous foods that we all grew up with are the best foods. Beans, legumes, corn, whole grains, that is the best food for dealing with obesity, for dealing with diabetes, and for dealing with heart disease, and even cancer. And so we need to rethink our diet. We need to go back to the basics. We need to go back to where we were. Fried chicken is not going to solve the problem, French fries from a fast food restaurant is not going to solve that problem. So I think in a nutshell, really, that kind of gives a perspective on the African problem.
Yeah. Let me turn to you, Olivia. Your home country of India is getting hit particularly hard now. The whole issue of vaccines and trying to get those out. But the question comes up is, isn't lifestyle enough to deal with COVID? Or do we need to do something more than that? We have 11 hospitals, Adventist hospitals throughout India, all of whom are struggling now. Some of the people I have as good friends are in those hospitals, not as doctors, but as patients right now because of the impact. Talk to us a little bit about the sense of what's happening in India and what we can do as a church, as a community to support them.
So right now, actually, my parents every day are getting calls or seeing Facebook messages coming through saying someone that they love and know has died. So just in this past 6 days, they have lost 5 family members and friends. So the impact has been devastating. And I don't want to downplay or belittle the role of lifestyle because it has a very big impact on our health, but we can't overemphasize how important the vaccine is. And the vaccine is not only if someone wants the vaccine, we also have to talk about how are people getting the vaccine. Are there enough vaccines in these countries? So we have to, I don't like separating the vaccine and lifestyle. They're both important, and we have to make sure that when we have that conversation about health, we have to talk about both of them together.
Yeah. April, let me go to you. We've heard from Scott and Ed. Obesity, metabolic syndrome is a huge factor in COVID. But do we have any answer for that? I mean, this country, the U.S., is one of the fattest countries in the world and growing. I mean, we're not tackling this problem. Mm-hmm. How do we deal with obesity?
Well, it's definitely a multifaceted problem. It's rooted in genetics, environment, personal lifestyle choices. It's not a single element that we can tackle. So I think we really have to think about this at a system level to be able to make sustainable change. We can't change typically our history and our genetics. There's some possibilities to do some epigenetic changes with things that we do with our lifestyle. But overall, we get what our parents gave us, and that's what we have. We also have environments, and I think that that's where we can think about how to be part of our communities, how to foster healthier environments, how to reduce food deserts, how to help our communities have places to walk, safe places to have recreation. There's a lot of different factors that we can think about. We can also look at, from a political perspective and financial perspective, incentives and disincentives. Some cities have chosen to have taxes on sugar-sweetened beverages, and that has shown to be beneficial in some locations, maybe not as much in others, but there's a lot of different avenues that we can pursue. And on an individual level, each of us can choose the journey that we're individually on and say, is the journey that I'm on one that's going to lead me to the health outcomes that I want to have? Is it going to reduce my personal disability and prolong my longevity as much as I can? And that will be limited by certain other factors, such as the other issues that I talked about. But for myself, for one, I want to live a long time. I want to enjoy my kids and someday my grandkids. So I think that that's one thing that we can take hope from, that we can have some ability to influence our own personal health outcomes as well.
Much of the work on vegetarian diets came from the Adventist Health Study here at Loma Linda, and it produced a lot of results showing the advantage of that. Corey, you've done a great job on campus of taking a vegetarian diet, even a vegan diet, and making it look good and taste good. Talk to us about that.
It is a challenge. I mean, when you are working in an industry where people are interested in what does the food look like, what does it taste like, how well does it fill me up? I mean, those are heuristic type of things that we judge our diets by, that when you start to get into a diet that doesn't include the fats, doesn't include sugars, doesn't include salts, those things that we intrinsically look for foods that are what we would consider to be good foods, it becomes quite challenging, certainly. And that is one of the things that we have really been testing a lot of here on campus, is just trying to see what is it that people are really looking for in foods. Why do they look for fats? Why do we look for high sugar diets? Is there a way for us to present a food in a different way to still be able to touch that person in the way that they're looking for through those other diets, and still be able to encourage them to eat the great foods that we know that they should? It is challenging. People want to eat a traditional diet. I'm used to that thing that my mom made when I was a kid. That's what I want to continue eating. And now I just want to change it so that it's good and healthy for me. And a lot of times I can't do that for you. But I can introduce you to a different food that is really unique in its own right and very good food, and hopefully create a new memory for you, a new passion, a new thing that you're interested in eating.
Yeah.
And that is the challenge that we face every day.
And so the irony of what you and Ed have said is very real. So many of us grew up with bad diets, and now we're trying to get into good diets. In many of the developing world, we grew up with good diets, and now we're drifting to bad diets. And it's the effective marketing, the effect of so many different things on us. Olivia, you brought a prop. Show us what 5 pounds of fat looks like.
So this gorgeous model shows us what 5 pounds of fat looks like in the body. And, you know, I think a lot of times when we eat tasty food, whether it's good or bad, we don't think about this. And we think about how we're feeling right now, but we don't think about this. And not only is this not particularly beautiful, you know, this model, but this actually creates havoc in the body. And I think that's what we all have been, you know, talking about this thing we need to think about when we're eating.
Scott, let me go back to you. You deal with a lot of diabetics. What is the role of exercise in diabetes control?
You know, first I want to say too, just commenting and agreeing with what everyone said on the panel, Dr. Hart. In the diabetes mindset, whether you're going down exercise or with diet, what I find is that the most successful patients with diabetes have had a fundamental shift in their mindset and perspective. And it's actually broader than just what they're eating. It's about a little bit of what April, you were saying, it's their perspective of life. Like, what are they looking forward to? How are they valuing what they're putting actually into their body? And when they have that fundamental shift in that paradigm of the way they think about food, then all of a sudden they change the way their behavior goes. So a lot of it, you know, for our education, whether it's diet or exercise, it really takes time in our education classes to help to change people's mindsets for the way they think about food. Even the commercials that are out there are focused very much on calories versus on quality. And I think that's what's very different about Loma Linda, is it's not just about reducing calories, although that's important, but it really looks at the quality and composition of the food and understands that it's more than just the calorie. It's actually both the macro and the micronutrients that really make up a healthy diet. So I just wanted to agree with what the panel was sharing there. And for exercise, it's interesting with diabetes, you don't necessarily have to lose weight. So a lot of people are very focused on weight loss, and that's important. But you can improve the metabolic syndrome and improve your insulin sensitivity just by being more active. And so we know in studies it doesn't take a lot to be more active to improve insulin sensitivity. When they've done studies in the US and in Europe, it's a matter of 15 to 20 minutes, even as low as 3 times a week, just walking. So I tell people it's not about how you're exercising, it's about getting into the habit of just moving, not sitting, but actually doing more movement. And when people begin to develop a habit, that's what actually changes their lifestyle and the way they actually behave.
Yeah. And Edward, you know, you talk about the change in diet as people have moved from the rural agrarian lifestyle to the cities. But the other big issue is exercise.
Absolutely.
You don't want to walk everywhere, anywhere. You don't want to hoe. You don't want to do those things. You actually are coveting a car and less exercise.
And actually, that's what happened because people are becoming more affluent. They can afford to buy a car. And so, you know, these people are moving from the rural from the countryside, rural areas where perhaps they were used to, going out to the garden, to their farm, and getting a lot of this exercise, and now they're having to, drive from work and back home, and there's not much time actually to be able to get some exercise or physical activity for that matter.
Yeah. And there's not many opportunities, frankly, in most capital cities of the majority world to find a place to exercise. I mean, the safety factor, the trails and so on are not there. I want to shift briefly to smoking, and we're not going to talk a lot about smoking, but this is a huge issue in much of the world yet. We've got our rates here down, I don't know, the latest April down to 11, 12%, I think, of Americans still smoke, down from 43% about 40 years ago. We've made progress here, but much of the world is not making progress. It was interesting, just recently, the US government is trying to outlaw menthol cigarettes. That's kind of a way to snag young people into smoking. But talk to us, maybe, Olivia, I mean, smoking in India is still a pretty big problem. Talk to us about what that means in terms of good health out there.
I think, in India, whatever country you're in, smoking, we can talk about smoking. And I think a lot of it is the messaging, whether it's food, whether it's exercise, whether it's smoking. Are we normalizing smoking? Are they in the movies? Are they on TV shows? Are they in advertisements? I know here in the US, we've stopped billboards and, that type of thing, but that's not everywhere. And I think we're normalizing, in a lot of places, we're normalizing smoking as a normal, everyday habit. We are normalizing eating junk food as a normal, everyday habit. And what's interesting about the marketing, I find the marketing fascinating because they make it look so fun. And when we think, and us as professionals, when we're sharing the exercise and diet and all of these things, it seems so boring, and it seems like such a task, and we're taking everything good away from you, and all the fun is lost. And I think that's where, no matter what country you're in, we have to say, this is not normal. These messages you're not receiving are really not healthy messages, and this should not be normal. And a healthy lifestyle is actually the most fun. You get to embrace life in such a fuller way when you're feeling better, and you are your eyes are different when you look at life when you're feeling better. And we have to stop, I think, normalizing, no matter what country we are in, normalizing these unhealthy behaviors.
April and Corey, is there an Adventist diet? Should Loma Linda be publishing, here's the recommended diet for the world, go and do likewise?
That's a great question. I think the findings of the Adventist Health Study, our history, as well as what we're seeing in emerging literature, position statements from professional organizations, definitely supports our history and the findings of the Adventist Health Study, which is moving towards less refined foods, fewer animal products, and a plant-strong or plant-forward approach is kind of the popular way to say it. So it's not about a vegan diet, because you can eat cookies and French fries all day and be a vegan. And I think we all agree that that is not a healthy pattern of eating. So it's really about having the good nutrition. What's going to nourish your body? What's going to give it the building blocks that it needs to reduce inflammation and to fight disease, and to hopefully, where we have those opportunities for epigenetic switches, to help make that switch towards a healthier direction. So I would say yes. I think there is kind of at a loose or general level, a loose collection of concepts or ideas that probably is a Loma Linda diet that's very high in fiber, that's very plant forward, and that minimizes foods that are not going to nourish the body to the level that the individual, in a patient-centered approach, feels comfortable with, but at the same time giving full disclosure so that they understand what their outcomes could look like depending on what path they choose. That's what I would propose.
Corey, I hear more and more talk about vegan diets.
Yes.
Talk to us about the difference between a vegan diet and a vegetarian diet, and what you would suggest.
So there are multiple ways of being vegetarian, as you're alluding to. The idea of vegan is, in the popular connotation, now says I'm not going to eat any product that comes from an animal source. Now, whether that is lean muscle tissue or whether that is a byproduct like eggs or milk or butter or those things, anything that comes from an animal, I'm not going to eat. So what does that mean for us when we're cooking? That takes a lot of the cooking tools out of the toolbox. but it puts a lot of other stuff back. And what the challenge, I think, with most people thinking about this idea of transitioning to an all vegetable diet, they're forgetting that there's a lot of variety out there to eat. When we walk into a grocery store, we see 30, 40 things on the produce aisle shelf that we are willing to try. But there's 60 things there that you could be eating. If you go into a farmer's shelf, there could be 150 things there that you could be eating. So we have to start thinking about expanding what we quantify, what we qualify, what we say is the foods that we're willing to eat. I have found so many amazing recipes from cultures and places around the world that have always been a vegetarian or a vegan recipe. Do they have ways of cooking that are not vegan? Yes, these things come from cultures that are definitely not vegan in their nature. But everybody has vegetarian options available within their eating plan, their eating pattern. Great place to start. Should we be transitioning our everyday recipes, the things that we're used to eating, to an all vegetable scenario? Well, as I said before, that's where it gets really hard. Loma Linda, we as an institution, we have a rich history of meat analogs. I mean, a lot of that stuff kind of started here on our campus. Now, in today's food world, we're seeing that really exploding, and there are a ton of really great options out there. If you just want to transpose a meat dish into a vegetarian dish using essentially the same ingredients, that is possible. But there are a lot of other options, and I encourage people to get creative and just try new things and to step out of their comfort zone when it comes to making that transition.
Edward, talk a little bit about, I've watched in the academic world out here, we've kind of started changing our nomenclature from a vegetarian diet to a plant-based diet. Why is that?
You know, it's very interesting that you mentioned the plant-based diet, because this is something very popular now. But you know, the definition of a plant-based diet is just as varied as you can imagine, and there's not one specific definition of a plant-based diet. But really what it means is that we are deriving most of our foods from plants. That's what it means, loosely defined, and preferably whole foods. So a plant-based diet really, when I think of it, I can relate it mostly to the Mediterranean type of diet, which is also considered a plant-based diet. And so when you look at the characteristics of a plant-based diet, is that it's high in fruits and vegetables, high in whole grains, high in legumes, and nuts, and of course low in red meat and other animal products. So the good thing with this structure is that it can be used for different settings. It can be used by different people. The whole essence is that we want people to consume more of the plant foods and limit their intake of meats and animal products.
Okay. Scott, I think you mentioned the term metabolic syndrome. Tell us a little bit more what that is and how that all fits together.
Yeah, so metabolic syndrome is a syndrome of insulin resistance. So when you have that syndrome of insulin resistance, usually it's coupled with other sorts of comorbidities like hypertension, like obesity. But specifically what we know about obesity is that it is fat, as was shown earlier, that is within the organs of the system. So you can get fat infiltration, particularly within the liver. And then that causes insulin resistance. And we know within metabolic syndrome, when you have this syndrome together, it increases this sort of pro-inflammatory state. And why are, people talk a lot about inflammation and metabolic syndrome. Why is that important? When you think about a heart attack, the vessels of the heart, when they are more inflamed, they're at increased risk for forming a blood clot. And that is then what causes a heart attack. And so there have been numerous studies looking at plant-based diets and the inflammatory state of a body, showing how there's actually an overall decrease within inflammation purely by a plant-based diet, independent of its role on weight. So it's sort of a complex syndrome that increases the risk for heart disease, increases the risk for diabetes.
April, let me go back to you. How does hypertension fit into all this? And how, if I walk into your clinic and I've got a 180 over 100, what are you going to tell me to do?
180 over 100. Well, at that moment, I would say we need to do something medically, using a medication, a pharmaceutical, to help lower your blood pressure to a safe level in the interim.
On the immediate basis?
Immediately, yes. We need to
So I
help
can
lower
walk
that
out
blood
again.
pressure. So you can walk out. We like to have the patients walk out of the clinic as well as walk in. So then I would inquire with the patient, what are your goals? What does your health trajectory look like? Where do you want to go in the future? What do you want that to look like? And some patients will be very open to an aggressive lifestyle focused approach and say, I'm willing to cut my salt significantly. I'm willing to incorporate 6 fruits and vegetables every day starting tomorrow, whole grains, legumes, the whole package that we've all just been talking about. I'm willing to walk regularly, try not to be as sedentary at work, start strength training. They're going to put the whole package together. And for those patients, typically within a short period of time, if there isn't some other underlying cause driving that hypertension, their blood pressure will come down. And we may be able to reduce or remove the medication based on that person's response. There's other people who say, I'm not quite ready to do that yet, and that's fine. That's their choice. And we say, okay, well, what are you willing to do? What parts do you want to incorporate? And we'll see how far that can get you. And then we'll reevaluate and see, do you want to make additional adjustments? Do you want to set additional goals that are more aggressive, or are you content at that point? And so I think it's a informed discussion that happens in conjunction with each patient. And I think also, to go along with what Scott said, it's all a very similar root cause of these inflammatory diseases. And each person, based on their background, their genetics, it may manifest differently in each person. One person may be more prone to showing insulin resistance sooner. Another person may be more prone to showing hypertension sooner, or some other autoimmune disease. But at the end of the day, probably around 70, 80%, maybe some studies even say 90% of the chronic diseases that we're dealing with have a root cause that's very similar, grounded in our very Western, unhealthy, sedentary, not nourishing diets and lifestyles.
Corey, can you help hypertension through diet?
I can help with education. I can help with providing new options or new ideas about what foods that you could be eating. But I really work with the individual's healthcare provider. I really want to know what is it that their doctor is telling them they need to do before I can start to offer the changes of lifestyle, the changes that they need to be looking at in the kitchen to make that work for them.
Scott, can you cure diabetes? Can you get me off all my medicines?
That is a great question. Actually, it's very controversial because some people say, when you go into remission, that is actually a cure. Scientifically, I would say from the evidence that you can go into remission with diabetes, but you don't necessarily cure it. Essentially, though, when one goes into remission with diabetes, it is a form of a cure because the hyperglycemia goes down. But all of these other factors that we talked about, hypertension, obesity, cardiovascular risk, those also are associated with this remission of diabetes. And so, I think when you think about diabetes management, it's really all about prevention of chronic complications, prevention of macrovascular complications. But it's also, I think, about trying to get into remission through lifestyle. And I really have to say I appreciate the fact of how we're going into different plant-based options that are available to patients. I think patients sometimes they do, as was mentioned, get stuck in, I ate this and this is what tastes good. And it's changing their mindset to say, what, there may be other things that you just need to be willing and open to try that you actually really will enjoy and also are good for you too as well. It's those type of people that I see come off the medications. We were talking about hypertension, coming off the medication, reduce their diabetes medications. Medications aren't necessarily bad, but when you have a strong lifestyle foundation, that's where you really can get the best prevention that's possible.
Olivia, you're a health educator par excellence. What should the local Adventist church do in whatever country to try to help its members and the community in dealing with some of these lifestyle habits?
I think we have to be very practical. And I think sometimes when a healthcare professional comes in and say plant-based diet, it can be very intimidating, and we don't understand necessarily what that individual, why they eat the foods they eat. What does that mean culturally? What does that mean emotionally to the person, the foods that they eat? And I think we have to talk to them about, let's avoid talking about taking out things. Let's say, what are we adding? What are we adding? What can we add to your diet? What can we add to your life that actually is fun and exciting for you? I have some props here again, but a lot of times we don't talk about, these bad things, they actually taste good. We don't acknowledge that. Sometimes we just label it as bad and say, cut it out. We have to acknowledge they taste good, and sometimes they're fast. No matter what country you're in, you probably have a fast food restaurant somewhere. And we have to talk about the cheapness of it, the cost of it, all of these things. We have to be extremely practical. So I think the churches we can meet people where they are, just like we do with the gospel. Meet people where they are, understand where they are, see what changes, to your point, April, what are they willing to do? So just very simply, are you a mayonnaise lover? Are you, is that something that you do and that you love? And you're vegetarian, because a lot of times how we talked about, vegetarians feel like, I cut out the meat, so I'm automatically healthy. Well, if you're replacing it, I'll tell you, this is light mayonnaise, and this one here is regular mayonnaise. This is the difference. So if we can start talking about these things very simply, one of these is a small French fry. 3 of these is a small cheeseburger. These are the kinds of things, if we kind of say, what is practical? Can we take baby steps? I think really that's where the church can really, really sing and introduce new messaging. The messaging is, it's not boring. It's fun. It can be delicious, and you don't have to give up everything that you enjoy.
April, so I've made a commitment. I'm going to get healthy. I'm going to lose 15 pounds. I'm going to eat better. Talk to me about exercise. Is there a particular kind of exercise that's magic? Do I need to join the gym and go get up a sweat every day? Or what is the best exercise plan?
Sure. So there's 3 different areas of exercise that I try to talk with my patients about. And I like to start with where they're at. So which thing are they most likely to do? And I think that that's the best place to start. The exercise that's best for you to start with is the one that you're going to do and feel like you can get started with most easily if you're not exercising currently. So I like to break it down into kind of the cardio aerobic activities, get your heart beating a little more quickly, exercise that heart muscle along with the rest of your body. The next one is strength training, building up your muscles. The legs are where our largest muscles of our body is, so that's kind of the biggest bang for your buck there, so to speak. And so doing that strength training, particularly for lower body, is going to help to tone that. And then I also talk about not being sedentary, because there's been a lot of discussion, we talked about smoking earlier, that sitting is like the new smoking. It's almost as risky to sit all day as it is to smoke some cigarettes every day. And I don't think we often think about that particular factor. So for each patient, it can look a little different. The aerobic cardio could be out going for a walk. It could be going to the gym if you enjoy that. It could be swimming. It could be working in the garden and just trying to set a nice pace while you're moving around and doing that. The strength training, I encourage a lot of patients who are trying to lose weight, because if they can build a little muscle moving on, that muscle's going to burn more calories, which makes it a little easier for that weight maintenance phase. And then finally, for people who are maybe not ready for either of those, or have a very sedentary job, I encourage them something as simple as kind of watching the clock or setting a timer every 20 or 30 minutes throughout the day to just stand at their desk for 2 minutes or walk to the water fountain, get a drink, and just move 2 to 3 minutes every 20 to 30 minutes throughout the day. And that seems like a good place. So we start with one of those and then start adding as time moves on as the patient is ready.
So I don't need to go to the gym. I can just work in my garden and
Yes,
good
sir.
to go.
Yes, you may.
Thank you. Thank you. So let's wrap this all together. We've talked about nutrition, we've talked about exercise, we've talked about the diseases, hypertension, diabetes. I think there's a growing recognition as I watch the literature that obesity is a disease. This is not a result of something, this is a disease. And in fact, there's medicines coming out now to treat obesity that seems to be, I guess, appetite suppressant sort of thing that let people to lose weight. So when you put those all together, talk to me about social support. How do you make this stuff happen? You've all talked about great things to do, but boy, I have trouble following through on my commitments.
Social support is really important, Dr. Hart. There's some studies that show if your friend is overweight, then you're more likely to be overweight. And then to a slightly lesser degree, if that friend's friend is overweight, and out to the third degree of relationships. So this social connectedness is really, really, really powerful in terms of influencing us. And so I think that from my perspective, we can't always change those friend groups. We may not want to. They provide other valuable supports to us, and they may be part of our family. But maybe we can be the person who starts to help reach that tipping point for our friend group, to encourage your friends and your social supports. Come on a walk with me. Let's do a food challenge together. I'm going to try to go from eating 1 vegetable a day to eating 3 vegetables a day, 1 at each meal. Will you do this with me? And so getting your friends to kind of come along and join in and then swap recipes and share. And that was really part of my own journey in lifestyle as I tried to move from a very highly refined vegetarian diet towards a less refined one. It was all about my friends. Yeah. Sharing recipes and getting out and being active together.
Edward, you talked a little bit at the beginning about the different nutritional patterns in different countries. Talk a bit more about that. I mean, what I'm hearing is going back to the traditional diets, but are there some things that need to be supplemented there? Do we need vitamins? What do we need to make a traditional diet better?
Well, yeah, it really depends, and I want to say that when we talk about going back to the traditional diet, we have to do this within the context of regional and also ethnic considerations, because when we look at an individual, what you eat in America is going to be different from what somebody in Europe eats and somebody in Africa eats, and in Latin America and other places, and so really. We first of all have to consider from the general diet of this population, what are the key lacking nutrients? And so sometimes, and I want to use Kenya for example, the staples that we have in Kenya, the staple diet is largely corn and traditional vegetables and beans and legumes. But sometimes you realize that there's perhaps a low intake of foods that are rich in calcium and other specific nutrients. So supplementation can be necessary at times depending on one's diet and also on age and different other factors. So I know we often say, don't supplement, you don't need supplements. But that, to me, that's not true, because there are moments and there are individuals that might need supplements. So that is just in a nutshell, as I can say. Maybe my colleagues can add.
So let me ask a bit of a tricky question. Do I need to take vitamin pills every day?
So I think the answer is we don't know, because I think that's Ed's point is that it's the individual person's history and health conditions, and that's very difficult. We might, in some cultures, if it's a very clear pattern, be able to determine this culture tends to be quite low in calcium, for example, or B12, and so then you need to supplement that. But in general, for most people, They're not lacking in vitamins at a significant level. And most studies looking at supplementation show that when you supplement beyond deficiency, so if you have a deficiency, we need to treat it. We need to get the supplements in there. But if you supplement beyond that, like let's just try vitamin E, let's try vitamin A, most of those studies actually show us that there's unwanted negative health outcomes as a result of that supplementation above and beyond the deficiency level. So we have to be careful.
And I have to say that, talking about calcium supplementation is a great example where there are actually studies that showed that people who really were able to get it through their diet versus doing supplement did much better in terms of overall outcome.
Because the vitamins we get in a combination of foods is in the right proportions, the body selects what it wants. So thank you, because I don't take vitamins and I don't plan to. Thank you very much.
I think we also need to be very careful. I think there are stores and online you can get these high doses of vitamins, and I think a lot of times people think, it's a vitamin, what could it do? Or it's a vitamin, more is better. And when you start taking the individual vitamins at such high doses, you really need to be talking to your healthcare provider.
Right.
That's absolutely.
Thank you all. From Loma Linda University Health, it's a privilege to be with you today. Thank you to our panel, Dr. Olivia Moses, Dr. April Wilson, Dr. Corey Geen, Dr. Edward Bitok, and Dr. Scott Lee. It's been a privilege to share with you some thoughts on good health from Loma Linda. Thank you all.